So WAYPOINT is actually a clinical study, and it's a phase 3 randomized double-blinded controlled study looking at the effect of Tezepelumab in treatment for severe nasal polyp. So the way we decide whether or not that Tezepelumab would be effective in our patients with chronic sinusitis with nasal polyp is to look at two primary endpoints. One was looking at the polyp size, the other one was looking at symptoms of nasal obstruction or congestion, very similar. And what we showed was that the change in the nasal polyp score was about 2 between the placebo group and the treatment group at week 52, which is tremendous. The other second primary endpoint was looking at nasal congestion. And they basically went from moderate to severe to basically mild symptoms. So these are things that patients notice. Another way to see if there's improvement in the patient's symptom is a patient-reported outcomes measure called SNOT-22. Now, what's nice about SNOT-22 is we have calculated the minimal amount of change in the SNOT-22 to show an improvement. So these patients had an initial score around 68, and what happened was there was a reduction of 45 points. So these patients were severe and they became mild, and it was almost 5 times that of the MCID. So these patients definitely noticed an improvement in their symptoms. You know, when we look at numbers, we say that there's statistical improvement, that there's 5 times out of the MCID. But what we want to do is to be able to translate that to clinical data. And so the fact that these patients had significant reduction in their symptoms translated to the use of medicines or interventions that patients would want for nasal polyp. And so one of them is the use of systemic steroids, which are very helpful in patients with nasal polyp. We saw a significant risk reduction in the use of steroids. And specifically for surgery, there was only 1 patient in the treatment group that required surgery, while in the placebo group, it was over 40. You can't really compare Tezepelumab to the other biologic because there really wasn't a head-to-head study. If you want to try to do an indirect treatment comparison, it takes a little bit of extra work, and even then, to try to normalize the data and make sure the data is kind of correlate to each other. But unless you really do a head-to-head, you really can't compare Tezepelumab to the other biologic. But with that being said, if you looked at the effect of Tezepelumab in the study itself, looking at different endpoints, it was significant. There was improvement in nasal polyp score of 2. There was improvement in the Lund-Mackay score, which is also very difficult. And as I said earlier, the SNOT-22, there was a reduction in 45 points, which is the best that we've seen so far. Tezepelumab works by blinding to TSLP specifically. And if we bind to the TSLP, which is high up, which is the epithelial alarmin, the theory is if we block that, could we block the downstream cytokine like IL-4, IL-13, and IL-5? And based on the WAYPOINT data, it seems to show that, that by blocking TSLP, we were able to block some of the other cytokines that I mentioned earlier. Yeah, what was nice to see from the WAYPOINT data is the fast onset of improvement in certain symptoms. So one is nasal congestion, which is one of the primary outcomes, and we saw that as early as week 2, which is the first endpoint that was measured. WAYPOINT also improved the sense of smell as early as week 2, which is also the first endpoint. And these are the 2 probably most important symptoms that patients are looking for. And as I mentioned earlier, there was a significant reduction in the SNOT-22, which translated to the rescue medication or treatment that patients would use. So we saw a significant reduction in the use of systemic steroids, and we also saw almost near complete elimination for the need for surgery in the treatment group. So the type 2 biologics, the biologics that target type 2 respiratory disease, whether it be asthma, nasal polyp, I think in general are very safe. Now, there are some adverse effects that we have seen while we've been using these medications more often, but overall, they're very safe, just like Tezepelumab and all the other biologics that have been approved for asthma and nasal polyps. Yeah, so what's great about Tezepelumab showing a very effective treatment for nasal polyp, what that means is we're hoping that Tezepelumab will be approved by the regulatory agency, and once it's approved, then we have one additional option that we can use. I think the choice of which biologic we pick really should be patient dependent and what we're trying to target. Most patients who would require a use of any biologic are usually the severe or uncontrolled nasal polyp. Most experts would say that if you have these severe or uncontrolled nasal polyp, you should at least have one sinus surgery to open up all the sinus cavities. And then if there's recurrence, most people will feel like these are the patients that would benefit from the use of biologic. Yeah, so, what's exciting is the phase 3 data for WAYPOINT has so much information. So I think the next immediate step is looking at a subgroup analysis of different endpoints and different study populations within the CRS with nasal polyp. And I think the next step would be looking at the subgroup analysis. And the thing that I'm also interested in is what happens after you stop the Tezepelumab. What happens to these patients? So off treatment, what happens? And so we still have to figure that out. They're collecting data on that, and there's a lot of work we're doing that. Certainly real world data, it would be nice because then you would see what it really does in patients in real world setting, because in a phase 3 study, everything is well controlled to make sure that you get really clean data. But in a real world study would be helpful because we know in the real world, life gets messy.